Hi, this is Ron again, and I'm back in my clinic in Oliveira de Hospital in the eastern mountains of Portugal. And today I want to talk about lower back pain. When we talk about lower back pain, we have two types, if you like. One is an acute one, and the other one is chronic. And let's start with the acute one because it's easier to fix, easier to talk about. You wake up in the morning, you go do some work, you work in the yard, you do a workout, you do something, and you wake up the next day and you can stand straight. In most cases, the problem is not going to be related to the spine, despite the fact that this is what most physicians will tell you. It has nothing to do with vertebrae that moved from one side to another, nothing to do with ruptures, nothing to do with anything like that. 99% of the times, it has to do with just a muscle that is very, very, very tight. Usually it's a deep muscle. Actually, it can be a core muscle, not even a back muscle. And the way we treat it is by using long needles. And I use I use about between 4 to 5 centimeters of needles. Very thin, you can hardly feel them going in. But I use heat as a mean of fixing it. So I'm looking for, I'm going to put you on your stomach. I'm going to look for the places where I find the pain or I find the stress. And I just stick needles very gently into this area until I start getting some kind of resentment from the body. I stop there. I heat up the needles, and by doing that 2 or 3 times at the same treatment, take needles out. In most cases, we see a difference of 50, 60, 80% of going back to your normal range of motion. In most cases, I need only 1 session to fix an acute back pain. Sometimes I may need another one, a second one, if I misdiagnosed the area where the pain is rooted. But this is an easy one to fix. The one that is a bit more difficult, but not much more difficult to fix, is what people call sciatica, or when the sciatic nerve is pinched. Sciatic nerve is a nerve that comes out between the vertebrae, the 5 lower vertebrae of the lumbar, and it connects and is responsible. It connects to one big stream and goes down through the glute and all the way to the leg. And in many cases, you may not even feel a back pain. You may feel that something is wrong with your leg. Unless you get to the point where you cannot move your leg anymore, and then you do need to go to a doctor, because then you need a different treatment. If you don't get to that point, but just pain or numbness or anything like that, this can be fixed. It takes usually a bit longer than an acute back pain. And the reason is because there is an underlying precondition. In Chinese medicine, we say that there is a dampness in the area, or what we call in Western medicine inflammation. And therefore, I'm going to do a very similar treatment to the one I mentioned earlier. I'm going to use a bit more needles here, but I need you to make some changes to mostly diet in order to fix the inflammation faster. In this case, when we talk about a chronic back pain like that, it takes a bit longer to see results. If I said earlier that an acute back pain takes usually 1 session up to 2 sessions, chronic back pain can take 3, 4, 5. It's never more than that. Anyone who tells you that he needs 10 sessions, 20 sessions, is using different techniques which may not be as good or as effective as the one that I use in the clinic. But this is the first pain that I'm talking about, that I do need a patient to come to the clinic. I can diagnose it from remote, but I need to fix it here in the clinic. The next pain we're going to talk about, which is going to be shoulder pain, is similar to that. I need patients in the clinic to be fixed. Talk to you next time. Bye-bye.